Hi everyone, myself Dr. Kirti here. Welcome to Pathology channel. So today we are going to discuss about something which is very basic and foundation, I would say, for pathology. That is a topic about cell injury. So everybody knows, quite familiar with this topic. You might have been read, but I'd like to take it more crisp and for the question. Okay. And coming to the cell in our body, every cell has the cytoplasm and the nucleus, right? So if there is any particular stimuli, the stimuli can be anything. I'll discuss about it later. So if there is any stimuli that goes and acts towards a cell, okay, so this cell will ultimately undergo damage. So the damage will lead to the cellular adaptation. So adaptation, we can discuss about what are the types of adaptation. So once the adaptation happens, it will disturb your, if it exceeds the adaptation, the stimuli keep on damaging the cell, and the adaptation cannot be reversing the cell. So ultimately it will disturb your cellular structures. So once the cellular structure is disturbed, it will decrease your nutrients and also the cellular survival, and ultimately it will go and lead to the cell injury. You understood the basic concept? So next, coming to the stimulus, what are the various types of stimulus which will lead to this kind of cell injury? Okay, so there are various number of stimulus. I'll list one by one. One is chemical, hypoxic, free radical, intentional, unintentional, your immunology, infection, and inflammatory. Understood? So coming to the definition proper of the cell injury, so it is the effect of the stresses. Okay, it is the effect of stresses due to the variety of etiological agents on the cell. So we saw the etiological agents just above, about what are the stimulus. So that stimulus will go act on the cell, and ultimately it will lead to cellular injury. That's what they are trying to say. So coming to the flow chart, you can see in this, the cell is a normal cell is there. If it is a normal cell, it will maintain the hemostasis, right? Homeostasis will be maintained. So if there is a stress, it will either undergo adaptation or injury will be happening. So adaptation is the first step, primary step. There is hypertrophy, hyperplasia, atrophy, metaplasia. We'll see about each later, okay? So if the cell adaptation means, if the stimulus is withdrawn, it will undergo into normal cell. So it is very reversible. Okay, if the stimulus is removed, it will lead to the normal cell. So that is your cellular adaptation. So if the cellular adaptation is exceeding the capacity of the cellular stimulus which is given from outside, it will lead to cell injury. So remember 2:2 rule. So there are two types of cell injury, that is reversible and irreversible. In reversible we have two types, that is cellular swelling and fatty change. And in cell injury irreversible you have two, that is necrosis and apoptosis. These are cell death. You understood the concept? So next, moving on to the types of cellular response to the injury. Okay, so we saw about what are the adaptation it will go, then it will go to injury. So we'll see about in detail about each. Okay, so coming to the nature of stimuli, if it is physiological or non-lethal injury, it will lead to your cellular adaptation. We'll see one by one with one fine example. So coming to the second one, that is if there is an increased demand or the stimulation of the cell. For example, if you take hormones or the growth factors they were saying, it will either go to hypertrophy and hyperplasia. So what is hypertrophy? What is the best example? If the person is going for strenuous exercise and gym and everything, he will build up the muscle, right? So remember, like a trophy. Okay, trophy will be won by the muscle man, right? In the BMW fight and everything and all. So that is a hypertrophy. So it's basically increase in size of the muscle. That is the thing you remember with the exercise and muscle mass and increase in size. Okay, so if you take hyperplasia, the best example is a gravid uterus. So if the female is undergoing pregnancy, the uterus will increase in size, but it will also increase in number of cells. Understood? And also in the breast there will be a certain changes. So this is called as hyperplasia. So you keep one example for each, so that it will be very easy for you to understand the concept. Okay, so the next one is atrophy. That is basically if there is no nutrients, there is a decreased stimulation or there is an injury. For example, in this you keep, if there is some accident and the nerve injury happened to the leg, and you are keeping the patient immobilization for prolonged days and months in a bedridden patient, so it will lead to the disuse atrophy. So that is a atrophy. Okay, the next one is chronic irritation, physical or it can be either chemical. That is known as metaplasia. What are the example? Metaplasia, what is the definition? So if there is a change of one differentiated cell into the another cell type, that is known as metaplasia. A best example you can remember for the undergraduate level is from squamous to ciliated, from ciliated to squamous. Okay, for example, chronic smoking, ciliated epithelium will change into squamous cell carcinoma. Okay, remember, like a classic example which you can easily remember the concept. So next, coming to the physical, chemical and infectious agent, it will go for two types of cell death. That is your cell injury. Okay, so that is reversible cell injury and irreversible cell injury. So in reversible cell injury, you have two. I told you two rules. So cellular swelling and fatty change are the two types of changes which is happening in reversible cell injury. So the second one is irreversible cell injury. In that we have the cell death. In that too again. So necrosis and apoptosis. Okay. And the next one is genetic and acquired causes. So if there is any defect in metabolism, it will lead to intracellular accumulation or pathological calcification. What are the intracellular accumulation can happen? It can be glycogen storage disease, it can be proteins, it can be accumulation of pigments or anything else, etc. And the next one is pathological calcification. So calcification means the deposition of calcium salts, right? It will lead to calcification. So there are two, again the two rule comes here. So dystrophic and metastrophic. So what do you understand from the term dystrophic? Dystrophic means a dead tissue. So for example, if you have to say, like in the worm, schistosomias and everything and all, those will undergo calcification. So that is the best example of dystrophic calcification. Or you can remember like a that is a papillary thyroid carcinoma. So in that, what happens in papillary thyroid carcinoma, there will be a long papillae, right? So there will be a supply for each papillae with a long fibrovascular core. So in the tip, the vascular supply will cut off due to over proliferation of papillary thyroid carcinoma. So this tip, the vascular supply is cut off, then it will undergo cell death. Okay, so that will form a somomatous calcification. Okay, so that is the best example for dystrophic calcification. What is metaplastic calcification? So metastatic calcification means you can say if the blood level is increased of the calcium, then it will go and deposit somewhere. So that is your metastatic pathological calcification. So the last one is sublethal injury, and ultimately that is your cellular aging, senile aging. So this is a separate question for PG. You'll see about it. So next, coming to the causes. Okay, what are the causes? Mainly due to idiopathic, oxygen deprivation, chemical agents and toxins, infectious agents, immunological response, genetic derangements, nutritional imbalances, aging and idiopathy. These are the various causes of cellular injury. So next, you can see in this diagram, there is some diagram which is shown here. That is the changes from the minutes to the hours. How the cell is undergoing reversible cell injury, what are the changes, and irreversible cell injury, what are the changes, evolving from minutes to hours we are going to see here. Okay, so if you see within a minute, there will be a reversible cell changes, that is your functional changes. First the cellular function will be affected, then it will affect grossly the morphology of the organ. Understood? So the first one is reversible cell injury, where the alteration in cell function will happen within few minutes if the stimulus is given. So the second, after some 1 hour or 2 hour, there will be a reversible cell injury. So for example, if you take MI, I'll give you examples for each so that you can remember the concept. Okay, so in MI, what happened? There will be a damage of cardio muscle, right? So that will lead to the damage and it will release your enzymes. What are the enzymes? You know, creatine kinase and all those enzymes are there. No, so those enzymes will be showing higher level in the serum level. Okay, that's how we estimate it. So that is the change which they are saying in irreversible, the biochemical changes of cell death. Okay, this after second hour, there will be ultra structural level. So there will be a tear in the myocardium, muscles and everything. So those are the things which we are saying as ultra structural levels. So after that, it will undergo into light microscopy changes. Okay, light microscopy, the cell cytoplasm and nucleus, everything will be altered. So that's what they're trying to say in the microscopical level. And finally, after some 4 to 5 hours, it will lead to the gross change. Okay, this is same to apply for all the types of cellular injury response. It can be necrosis or apoptosis, whatever it is. Okay, so first coming to the reversible cell injury. Okay, reversible cell injury is early stage of one, where if the stimulus is removed, then the cell will undergo into normal type. Okay, the light microscopy features are shown in two features, that is cellular swelling and fatty change. So coming to cellular swelling, the main causes are toxins, poisons and malnourishment. What is the mechanism behind this? So the cell will have a sodium pump thing will be there, right, to maintain the hemostasis and everything. So this sodium pump will undergo failure. So this will ultimately lead to the water will be pushed up into the cytoplasm. So the water will come within the cell. That's why your cell will get enlarged and it will increase the water content. It will increase in weight, and due to this increase in water content, the cell will compress. All the blood vessels around the cell will be compressed and will give a pale looking area. We'll discuss about it. So what are the major organs which is involved in cellular swelling? Kidney, liver, heart and muscle. Okay. So coming to gross changes, it's the earliest feature, I would say, cellular swelling. So it will undergo pallor. We discussed already, there will be a cellular water content will be raised. So there will be a increase in weight and it will compress your blood vessels. It will give a pale looking color to your organ. Okay. Coming to microscopy. So there will be a small clear vacuoles in the cytoplasm, and there will be a disjointed pinched off endoplasmic reticulum, and pale color appearance is mainly due to the loss of RNA. Okay, so the example is convoluted tubule of kidney. So you can see in this diagrammatic picture, the one side you can see the normal kidney where the architecture is maintained, and the other side you can see the infarcted one necrosis had undergone, where the outline is preserved but you cannot differentiate the cytoplasm and nucleus. Okay, this is the best example. So next, coming to the electron microscopy. Okay, what are the ultrastructural changes which will happen in the cellular swelling? So plasma cell membrane blebs will be formed in mitochondria level, amorphous density, and there will be accumulation of myelin figures. Endoplasmic reticulum will be detached and clumping of nucleochromatogen will happen. So you can see the same in the diagram. So there is a plasma cell bleb, the number 1, and the number 2, there will be a mitochondrial swelling mainly due to the accumulation of water and calcification, and the third one you can see the myelin figures, and the fourth, the endoplasmic ribosomes will be disaggregate due to the damage of endoplasmic reticulum dilated, and then it will finally disaggregate. Okay, and the last, there will be a aggregated cytoskeleton elements, and segregation of the granules, nuclear chromatin level changes will happen at the last. Okay, so next, coming to the steatosis. Steatosis is a fatty change. Okay, it's mainly accumulation of the triglyceride, that is your lipid vacuoles in the cytoplasm will be seen. So it basically affects liver, heart, muscles and kidney. Okay, and how will you appreciate in gross? It will be yellow, soft and greasy. Microscopy wise, you will see the small vacuoles in the cytoplasm. It can range from microvesicular to macrovesicular. So today we have covered up the cell injury, what are the types and what are the pathogenesis, and you have to know what is the stimulus and what is the cell response flowchart. You have to know what are the causes of stimulus, and then ultrastructural level. Then we have discussed about each thing, that is a reversible cell injury. In that we saw about cellular swelling and fatty change. So these are the key points which you have seen for today's topics. So thank you.